Hey everyone, and welcome. Today, we are diving into some really cool science that could totally change how we think about everything from medicated creams to cosmetics. We're talking about a breakthrough in delivering medicine more smartly using this unique stuff called a bigel. So let's get into how it all works. It's a great question. You put on a cream, right, and you expect it to keep working, not just for a minute, but for a good long while. But getting a medicine to release slowly and steadily instead of all at once, that's actually a massive scientific challenge. You see, the problem with a lot of these things is that they dump their active ingredient in this one big initial burst. And honestly, that can be pretty inefficient and way less effective. The real holy grail is to create a system that delivers a controlled, consistent dose over many, many hours. And that is exactly what the researchers in this study were trying to do. Okay, so to really get how they pulled off this brilliant solution, we have to meet the basic ingredients first. We're talking about two very different kinds of gels that are the foundation for this whole innovation. First up, we've got the hydrogel. And the name pretty much gives it away. Hydro means water. It's a gel where the liquid is plain old water, and it just loves to hold on to water-soluble things. For this particular study, the scientists used a really common natural polymer called guar gum to make their hydrogel. And on the other side of the ring, we have the organogel. As you might guess, its liquid base is organic, in this case, an oil. This study used sesame oil, and they thickened it up with a gelling agent called sorbitan monostearate to create this oil-loving gel. So you can see we've got these two totally different characters, right? The hydrogel is water-based, the organogel is oil-based. One feels kind of cool and watery, the other smooth and oily. And here's the most important part. They like to carry different kinds of ingredients. This whole distinction is the absolute key to everything that comes next. So this is where the magic really happens. What if, instead of choosing one gel or the other, you could combine them into something brand new? The researchers called this amazing new material a bigel. And as the source paper explains, it's not just a simple little mix. Nope, it's made by taking the two separate gels and blending them together at a really high speed, what scientists call a high shear rate. The process itself is actually pretty straightforward. First, you heat up the two separate gels. Then comes the critical step. The hot organogel is whipped into the hydrogel at a super high speed, we're talking 1,000 RPM, to break it up into these tiny little droplets. Then, as the whole mixture cools down, it sets into a completely new and stable substance, the bigel. And the result is this fascinating gel within a gel structure. What we're looking at here is basically a microscopic matrix. You have tiny little droplets of the oil-based organogel that are perfectly suspended and trapped inside the bigger water-based hydrogel network. So cool. Okay, so creating a new material is one thing, but proving it actually works, that's a whole other ballgame. The scientists created 4 different recipes for their bigel, all to find the absolute best combination. So they tested these 4 different formulations, and each one had a different ratio of hydrogel to organogel. They just systematically increased the amount of the oily organogel in each version, asking a pretty simple question: how is this going to change the final product? Now, before you can even think about delivering a drug, your product has to be stable. I mean, it can't separate or break down or change over time, right? So the researchers put these 4 bigels through some seriously tough tests, including some really harsh freeze-thaw cycles. And the results? Well, they were crystal clear. The first 2 formulations, the ones with less organogel, they just fell apart under all that stress. But GG3 and GG4, they were incredibly robust. They held their structure perfectly, even after 6 months. So the takeaway here is that a higher amount of the oil-based gel was the secret sauce for creating a stable structure. All right, now we get to the real test. Could these super stable bigels, GG3 and GG4, finally solve that initial burst problem we talked about at the beginning? To find out, the scientists loaded them up with an antibiotic called ciprofloxacin. And the results were like night and day. A standard simple hydrogel just dumped over 90% of its drug almost instantly, but the best biogel formulation, GG4, released just 26% over a full 12 hours. This is exactly the slow, steady, controlled release they were hoping for. In the world of pharmacology, this is what's known as zero-order release, and let me tell you, it is the absolute gold standard. Think of it like a perfectly steady dripping faucet. It gives you a constant, predictable amount instead of someone just splashing a whole bucket of water on you at once. Okay, so it works perfectly. It's stable. It delivers the drug exactly how it's supposed to. But there is one final critical hurdle to clear. Is this new material actually safe to use on human skin? Well, the researchers tested the bigels on human keratinocytes. Those are the main cells that make up the outer layer of our skin. And the result? Over 95% of the cells stayed healthy and totally viable. This is a huge, clear sign that the bigel formulation is non-toxic and safe for us to use.
So, when we put all of this together, what does it really mean for the future? Let's zoom out and look at the big picture takeaway from this incredible research.
So what makes this bagel such a game changer? Well, it achieves that perfect steady zero-order release we've been talking about. It's super stable without needing a bunch of extra chemical additives. It's safe for our skin, and get this, it has the potential to deliver both water-based and oil-based medicines. And on top of all that, it's actually simple and cheap to make. And the potential uses here are just huge. I mean, this isn't just about one antibiotic. This technology could lead to way more effective antifungal creams, better anti-inflammatory gels, and even next-generation cosmetics that deliver their active ingredients more efficiently over a much longer period of time. It's really a powerful reminder that sometimes the most elegant solutions come from combining simple ideas in a totally new way. And it leaves us with a pretty fascinating thought. If a gel within a gel can revolutionize topical medicine, what other complex problems out there could it help us solve?